what I think is really key to the high reliability journey that MedStar is on is making sure that the culture, and this is sort of a little overstated because we talk about it all the time, but the culture of how people do things, a culture of mindfulness, being thoughtful about what might cause harm to the patient is clearly number one. It's really a mindset, it's an approach that we have to develop. And the only way you do this is by doing the education and the teaching and the role modeling and putting into place some of the things that we put into place that really make big differences. For example, stories make a tremendous difference. And those stories resonate. People get that. Everyone gets that. Patients get it, associates get it, physicians get it. When we start to tell those stories and start to say, this was a good catch, we prevented someone from getting harmed, this was a near miss, something that could have happened that didn't happen, or this was a devastating error that we have to be transparent about and talking about. Those things resonate with people and they really make a big difference.
What we need to do is to give them the tools to get even better and become highly reliable. So in some ways, it's easy because all of our healthcare workers are fertile ground for this concept. All they need to do is be given the tools. So we discuss, we tell why we want to do this, we want to show how it's better for our patients and how we can become more highly reliable and deliver safe, effective care. And once you can explain those concepts and show them how it works and show what happens when we're not there, it really is an easy concept for them to buy into and really want to be a part of it. And so part of what we do is engage our physicians. And so when we talk to our physicians and say, we want you to be a leader in this, we want you to be out front, we want you to be a champion, we want you to be visible to all of our associates and other physicians, it's really very gratifying to see the physicians step up and say, I want to be a part of that. I want to help lead this process.
Some of the most important factors that are taking MedStar to become a high reliability organization are the focus on patient safety, putting patient safety at the epicenter of the patient care, bringing in all aspects of the organization, not just physicians, but nurses, technicians, environmental workers. Everybody plays a role in taking care of the patient. Everybody has an obligation, a responsibility to do what they can to highlight the focus on safety that the organization has. As MedStar is doing part of the culture of the entire organization, then it becomes a second nature.
Some of the big things are the daily check-ins, the safety huddles, which have been rolled out, which I think work pretty well at this point. They're still higher up and not everybody sees that, but sort of the next phase is the daily safety huddles that are unit-based, so that the staff that are on the ground are participating in these huddles and they understand the importance. Rolling all of that out to everybody in the organization. I think another big thing is getting the program underway to roll out to everybody in the organization, understanding that there is a culture change underway and things take time, but it can't happen if just the leaders know about it. Every clinical person, non-clinical person has to know about it and have the same degree of investment and belief in it. And so I think the program that MedStar is rolling out right now is really pushing for every member of the staff to have a role and an investment and a belief in it.
My premise is that you've got to have a compelling vision that can be shared from the top down and the bottom up. Compelling vision of patient safety, quality, service, etc. And in order to really affect that, then you've got to have very visible and very connected leaders. And for a leader to have an impact, the leaders have to develop trust between them and the staff, and you have to share information. In order to move forward, information is critical, trust is critical, and really good, clear, transparent communication is critical.